Hi everyone, I am Chloie Feyne T, Heierro, and today I am going to talk about corticosteroids. So what are corticosteroids? Corticosteroids, also called steroids, are drugs used to treat an array of inflammatory, respiratory, and autoimmune disorders. Corticosteroids are drugs which mimic a hormone called cortisol. So, cortisol is a hormone that the body produces at times of stress. And it helps rapidly reduce inflammation and temper an overactive immune response. Corticosteroids have strong beneficial effects, but there is also a potential that it can cause negative effects. Next, we have the two forms: oral and inhaled corticosteroids. Again, corticosteroids are synthetic medications that suppress the immune system and alleviate inflammation. When inflammation in the airways is controlled, the risk of an asthma attack is also lessened. Next, we have a picture which shows the difference between inhaled and oral corticosteroids. So although inhaled corticosteroids and oral corticosteroids have similar mechanisms of action, they have different indications for use, they have different side effects, and also drug interactions. By mimicking the action of cortisol, corticosteroids can temper inflammation when used locally or through inhalation or injection, or systematically through pill, oral liquid, or intravenous infusion. This action is important in controlling a disease like asthma, in which persistent inflammation can increase airway hyperresponsiveness, or there is a sensitivity to asthma triggers like the allergens. As shown in the picture, the inhaled corticosteroids is used for the treatment of persistent asthma, while the oral is used for treatment for severe asthma or severe asthma attacks. The inhaled is intended for long-term use, while the oral is only intended for short-term use. So the difference between the two is that in the inhaled, there is fewer or less severe effects such as headaches, sore throat, common cold or flu, and muscle aches in humans, while in the oral, the effects are more severe such as nausea, acne, weight gain, and irregular heartbeat. In the inhaled corticosteroids, because they are delivered directly to the lungs, inhaled corticosteroids require smaller doses. So it is measured in micrograms. It has fewer side effects, and as said earlier, it is safer for long-term use. Then in the oral corticosteroids, because they are delivered systematically, which means via the bloodstream, the oral steroids require larger doses, which is usually measured in milligrams. They have more side effects, and with long-term use, they pose greater harms. It is also said that inhaled corticosteroids can be used in all stages of persistent asthma. As the severity of the disease increases, the dose will also increase. Next, we have examples of inhaled corticosteroids: the Alvesco, the Asthmadex, Flovent, Pulmicort, and Kuvar. Fluticasone propionate, or the brand name Flovent, is a glucocorticoid used most commonly as an inhaled treatment for asthma or other respiratory diseases which involves the trachea and the bronchi. The use of Flovent in cats and dogs to treat airway disease is off-label. This means that you really have to follow the veterinarian's instructions, as the off-labels are significantly different from those on the label. As mentioned earlier, inhaled corticosteroids have a relatively low risk of side effects when compared to the oral corticosteroids. So here are some of the side effects of inhaled corticosteroids: cough, hoarseness, oral fungal infections, and in humans, we have muscle aches and also the headaches. Next, we have the oral corticosteroids. Oral corticosteroids are used either to treat a severe asthma attack or to provide long-term control of severe persistent asthma. Severe persistent asthma is a stage of the disease where the lung is severely impaired and the previous medications have failed to control the symptoms. So in cases like this, oral steroids are prescribed on a daily basis in combination with other medications. Here are some oral corticosteroids. We have dexamethasone, methylprednisolone, prednisolone, and prednisone. Prednisone and prednisolone are the most commonly administered oral corticosteroids. Prednisolone is more effective in cats. And in dogs, prednisone or prednisolone usually has mild or no side effects at all. So the incidence of side effects increases as the potency of corticosteroid increases. Therefore, oral dexamethasone should only be used if no other treatments have been successful because of the side effects that could possibly affect the pet's life. Then here we have some of the side effects from oral steroids. We have the common side effects, which are vomiting or nausea, increased risk of infections, particularly bacterial skin infections, lethargy. Then we have mood or behavioral changes, and the severe side effects could be muscle weakness, thin skin, and poor hair coat of the animal, and lastly, osteoporosis.